Hello, everyone. This is a short video on common entrapment points of the vagus nerve. So the vagus nerve is a major, really important nerve for your body functions. It's one of your cranial nerves. It's the longest cranial nerve, and it runs from the base of your skull all the way through your throat, your heart, and into your gut. And it's responsible for so many things, such as the depth and quality of your breathing, digestion, heart rate, all of your internal organs, or most of them, not all of them. So it's really important. That's the short of it. And there, like any other nerve, it needs to be able to move. Nerves run through tissues, but they need to be able to move through those tissues. And if you've ever had a surgery or damage to tissues, that can be scar tissue or adhesions around any nerve in your body. So I want to share with you some of the common entrapment points for the vagus nerve. If there have been issues in any of these different areas, it's something to consider if you're having issues with your vagus nerve. Issues with your vagus nerve might show up in the form of really poor digestion, irregular heartbeat, inability to speak, literally like your voice isn't able to project, you can't make sound, hard time swallowing. There's a lot of different things that can come with vagus nerve damage. Also, an inability to kick into parasympathetic response in your nervous system. That is the vagus nerve. So that's the rest and digest part of your nervous system. So if you're unable to really access that and you're in a constant sort of sympathetic fight or flight state, then you need to check out your vagus nerve for sure. So let me share my screen with you so I can share some of the common entrapment points. So first, let me just show you, this is generally the way the vagus nerve looks. Of course, it might vary from body to body, like anything, but this is the basic of it. Comes out of your brain stem, down through your throat, through your heart, through your organs, and into your gut. So pretty major. So the first common entrapment point is called the jugular foramen. So if you see this little white box right there, that's what we're looking at. This small little gap where all these yellow nerves run through, two bones, that is the jugular foramen. It's like literally at the base of your skull. So this could potentially become damaged with major impact to the head. So major car crash where you whack your head on either the back or the front or the side, impact, blow to the face, side of your head, ear. Those are pretty dramatic things that you would probably remember. Another thing that I like to point out that maybe isn't so obvious is if you were in the womb and you had the cord around your neck, there's potential that your cervical spine and this little small pocket where the nerves run through could be compromised or could have been compromised. So the jugular foramen is the first stop on our areas of common entrapment. If you have had major issues with that area of your body, major car crashes, hits to the head, stuff like that, number one, I would definitely address any cervical mobility issues. So making sure your neck can move in a whole bunch of different ways, pain-free. Also, traction could be helpful where you're having a gentle lengthening of your spine. But something that I personally found to be really, really valuable is craniosacral therapy. Not all craniosacral therapists are created equal. So if you've been to one and you were like, meh, wasn't that great, keep looking, see if you can find someone who's really well trained, because it can be super impactful on releasing old stuff holding around the base of your skull and your cervical spine. So if you've had any big trauma or injury to your neck or skull, I would check out that type of therapy. Okay, so the next area on our entrapment is the SCM. The SCM is this major muscle that when you turn your head, hold my hair back, when you turn your head, this big muscle that pops out, that is your SCM. And if that happens to be extra tight, maybe because you had some whiplash and your head got thrown forward and back, or if you've had any damage to that particular muscle, That can be a problem for the vagus nerve, for its ability to move through the tissues. Also, you have something called your thoracic outlet, which is this whole area. Let me show you a slide of that. The thoracic outlet is on this weird, creepy slide where all these nerves run out. So they come out of the spine. This is your brachial plexus, those nerves, and the thoracic outlet is right here. It goes, your collarbone would be above this bundle of nerves and blood. It's been removed in this drawing. Although the vagus nerve does not actually go through the thoracic outlet, any issues with this area can result in compression on the vagus nerve higher up because everything's connected, right? Fascia, muscle, you cannot just distinguish one area separate from another. So if you have, say for instance, a really strong forward head posture, or your arm is internally rotated a lot because you're on the computer all day, hunched over, this area is getting chronically tight, it can pull on the fascia and the muscles that are a little bit higher up that the vagus nerve runs underneath. So that can be a common entrapment point. So keep that in mind. If you're someone who's like, oh, it's always so tight in here, that could be a problem. Then from there, we're going to go, oh, let me show you the forward head posture because it puts some things in perspective. You can't really see your vagus nerve on the normal image. As soon as your head starts to migrate forward, the nerve and your cervical spine start to get stretched and pulled on, and it's not a good look. Let me just say that. There's measurable dysfunction that can happen with the vagus nerve the farther forward your head goes. So try to get your head on top of your body. Try not to look down at your phone all the time. Maybe lift your phone up, raise your screen up. Try to keep your head from bowing in front of your body. Okay, so we talked about thoracic outlet. We talked about SCM. So the next two places that are common entrapment points are the diaphragm and the gut. So the vagus nerve doesn't actually innervate the diaphragm, but it does, if you look down here in this bottom left corner, the smaller image, this is your esophagus, and then you've got that yellow nerve, which is part of the vagus nerve. Then this weird looking donut thing is your diaphragm. Your diaphragm is huge. That's not the extent of it. It's been cut away for this image, but that is where your diaphragm kind of circles around the esophagus. And the vagus nerve runs underneath there through that little small passageway with the esophagus. So if you have issues with your diaphragm, that can create a little bit of dysfunction with the vagus nerve. Also, every time you breathe, your diaphragm pushes down on all the organs, and your vagus nerve innervates all the organs. So if the diaphragm is not moving properly, it's not pushing and pulling up and down on the nerve, that can also be a little bit of a problem, meaning there's lack of input to the vagus nerve because it's not getting as much movement because the diaphragm's not moving very well. So diaphragm could be one particular area that could cause some problems. And then the last part is just your gut, which this is a pretty major part. As you see in this main image, the vagus nerve runs through all of this stuff. It's major. And if you've ever had any surgeries in your gut, that can create scar tissue or adhesions around the vagus nerve. So cesarean, removal of your appendix, any surgeries, any abdominal surgeries, or if you've had any major back surgeries where they had to go through the front to address the spine, that could be another issue. Pregnancy, even though our bodies are designed to give birth, there can still be some scar tissue and issues that come up from the impact of carrying another living being in your belly where the vagus nerve is. So yeah, I'm trying to think if there's anything else. Those are the main entrapment areas. So as you're thinking about this for yourself, it's good to just check in with all of those areas and, notice, oh, wow, I have really poor digestion, and it's been going on ever since I had that abdominal surgery, or ever since I had the heart surgery. The vagus nerve goes through the heart too. So it's not just for women having cesarean, any surgery from basically your mouth all the way down to your anus. If there's been a surgery there or a major impact or a puncture, you have to consider the surrounding tissues and the vagus nerve that runs through those tissues. So, okay, so this is the video about common entrapment points. If you have any questions, just pop them down in the comments. And thanks for being here.